Good evening. Welcome to this Ask the Expert event focused on breast cancer from diagnosis to treatment and survivorship. Tonight, in honor of Breast Cancer Awareness Month, a panel of experts will share crucial information about prevention, early detection, and support for those diagnosed. We will also answer your questions live. To submit a question for our panel, simply drop it in the chat right here on Facebook. Let's meet our panelists. First, we have Dr. Kay Blanchard, a cancer surgery specialist with Mary Washington Healthcare. Next, we have Dr. Krista Illich. Dr. Illich specializes in breast cancer surgery and endocrine surgery with Mary Washington General Surgery. In addition, we're pleased to welcome Dr. Meredith Whitaker, a board-certified and fellowship-trained breast surgeon with Mary Washington General Surgery. From the Mary Washington Healthcare Regional Cancer Center, we have Ashley Sisson, an oncology nurse navigator and registered nurse. Welcome, and thank you for joining us this evening. Dr. Blanchard, I'd like you to start the program. For so many, the diagnosis of breast cancer can come as one of life's biggest shocks, while for others, it might be something they've considered for a while, whether due to family history or some other reasons. How can individuals assess their risk for breast cancer, and are there any specific tests or screenings they should consider?
That's a really good question, and there's a lot of different ways to approach this. The actual risk assessment is often done by the radiologist. When they get their first mammogram or any mammogram, they will plug their risk factors into a model called the Tyrer-Cuzick model, and will actually come up with what your lifetime risk of breast cancer is. So that's one way that the risk assessment can be done, and that's based on family history, a lot of factors that are taken into that calculation. So in terms of screening, the actual screening that most people do is the mammogram. Often an MRI can be added, a breast MRI can be added to the screening if the risk is greater than 20%. And insurance companies do support that because that is a screening modality that can pick breast cancers up very, very small. For some patients who have extremely dense breast tissue, ultrasounds can actually be added as well.
Thank you so much. Dr. Whitaker, I'd like to begin by welcoming you to Mary Washington Healthcare as you've more recently joined our team. We're so happy to have you here. Can you explain the different types of breast cancer and how treatment approaches vary between them?
Thank you so much for inviting me.
I'm so sorry, Dr. Whitaker, to interrupt you. Sorry, we're having some mic issues.
Oh no, okay.
That's okay. We will come back to you, I promise.
Okay.
Thank you. I'm so sorry. Dr. Illich, advances in medical treatment and care are being made every day. What are the latest advancements in breast cancer treatment, and how do they improve patient outcomes?
Great question. So I think that there's advances both from the medical perspective, but then also as we're talking from a surgeon's perspective, things that look at both diagnosis and screening, and then how we actually treat the patients. So certainly we need our medical oncologists who can speak more to the advances in systemic or medical treatment, but there have been continuous ongoing clinical trials that are really advancing things. And the whole goal of this is really to try to be as effective at treating the cancer, but also, minimizing the side effects for patients. But when we talk about the whole picture of breast cancer, I really think about this from where it starts with screening, and kind of Dr. Blanchard already hit on some things, the importance of advancement in technology, and also even just from radiology. So our screening modalities, when patients are seen at the radiology suite, have really come a long way, and they will continue to come a long way with our mammograms. That now are 3D mammograms, incorporating MRI when necessary, and then ultrasounds. And I think we'll continue to see technology evolve with that, which is really advancing breast cancer care overall. And then specifically from treating a patient from the surgical perspective, we're always looking for ways to elevate not only our surgical skill, but specifically how we can better this for our patients. And really, less is best kind of approach now these days. And minimally invasive is really the ticket. And the way to do that is by implementing and bringing in technology in the operating room through localization techniques, ways that we can find these very small breast cancers. So we can operate when we can't even necessarily feel them, but we can find them. And then also ways to remove them in an approach that's called minimally invasive or minimal hidden scar technique. So we need to place the incision in an area that will give the most superior cosmetic look, so the patient can't see it. So we need to have lighted retractors and certain surgical dissection tools at our disposal to use in order to give that advanced approach in treating the patient. And then, of course, this extends into the plastic surgery reconstruction field, and they're evolving at all times in order to also give our patients different options. Again, all just continuously thinking how to move the ball forward.
It truly is incredible. Thank you.
Mhm.
Dr. Whitaker, I'm hearing from our team that we're ready for you. Just a reminder for the audience, we're talking about the different types of breast cancer and how treatment approaches can vary between them.
Yeah, so thanks so much for having me. Sorry about the mic issue before. But I was saying that there are many, many different types of breast cancer. So I could talk for hours about the different kinds and the different treatment approaches that vary between them. But I'll start off with two main differences. There is non-invasive breast cancer and invasive breast cancer. So non-invasive breast cancer is actually stage 0 breast cancer, but we still treat it by surgically removing that area, and also mostly adding radiation for most patients, and also adding some other medications after the surgery to help prevent any cancer cells from coming back or growing or going anywhere else. For invasive cancer, treatment is very similar. We remove that area, and oftentimes we also have to look at lymph nodes to see if the cancer has gone to the lymph nodes, which can predict if the cancer is going to go anywhere else. And then also, most patients will receive radiation and also some sort of medical therapy afterwards as well.
Thank you so much, Dr. Whitaker. Dr. Blanchard, here at Mary Washington Healthcare, we take a lot of pride in our comprehensive cancer care. Can you tell us a little bit more about what that really means?
Well, it's a unified approach for breast cancer. It's not just surgery, it's not just radiation, it's not just oncology, but there's a whole, and Ashley will be able to talk a whole lot more about that. But we meet together as a group, often as a part of our tumor board. About once a week, we discuss particular patients and how we should move forward. So the patient is being seen usually by a multitude of people, with always a lot of other people available for providing support and information. So the comprehensive part of it is treating the patient as a person and not a population, because so many times I have patients come in and said, well, I heard on the internet, or I have a friend who, and you just can't say that friend or whatever you read on the internet is how to approach you as a person. We have to take in a whole lot of different factors, and that's where the comprehensive part comes into play. And so we try and individualize treatment according to the patient's needs, their social situation, a lot of times, their family situation, and their health matters. There's a lot of issues for comorbidities where they may prevent other kinds of treatments that are available. We always have a multitude of plans to come up to treat the patients on an individual basis.
Thank you so much. Yeah, you mentioned a multitude of people, and Dr. Illich, that kind of leads me to my next question, which is Mary Washington Medical Oncology recently began offering a multidisciplinary breast clinic. Can you explain how this clinic works and how it's beneficial for our patients?
Yeah, absolutely. And it's a great segue off of what Dr. Blanchard was just talking about, because it really is a comprehensive approach. And I think medical oncology, yes, they did start it, but it really is the team that is providing it. Not to discredit them in any way, but it really is a whole multiple of specialists coming together and the whole team that's coming together. So really, this is a clinic that's elevating the bar of cancer care here at Mary Washington and the Fredericksburg area. I would absolutely say so. This is where patients who are receiving their new diagnosis of breast cancer, which understandably is just in a very emotional, terrible time that they're going through, they're identified and given that diagnosis, and then they are offered the opportunity, if appropriate, to be a participant in the multidisciplinary clinic. And what that is basically an opportunity for the patient to meet most players on the team in one afternoon to come up with one big plan that is individualized to the patient. So exactly what Dr. Blanchard was saying, that we really there are many ways that we treat breast cancer. It's not just the surgical approach. It's not just the medical oncology approach. It is radiation oftentimes, or at least a discussion about that, chemotherapy and a discussion about that, and the surgeon. And so that clinic has both the medical oncologist, the surgeon, the breast surgeon, as well as the rest of our team, which incorporates our social worker, consideration of genetics, if that's appropriate, genetic testing. Our very important nurse navigator, Ashley, she can speak to her role. And we also have Megan, who's part of that. And so the patient and whoever comes with him or her, they meet all of us in that afternoon. We also review their case prior to meeting with the patient, and we come up with a plan that we think cohesively will be the best approach. Of course, we then have to speak with the patient and come up with that plan, the finalized plan altogether. But it really is a way to provide an opportunity for the patient to have all that in one afternoon, which, having received that devastating news of breast cancer, coming up and getting a plan in one afternoon really is paramount, and it really keeps things moving along. The momentum, once you have a plan and that can be executed, part of the anxiety can at least be abated, and we get going. We hit the ground running, and so it's really really added, like I said, elevating the care here at Mary Washington.
I can imagine seeing in one of those visits, seeing all the people that are in your corner can be a little bit comforting in such a horrible moment. So thank you.
Mm-hmm.
Dr. Whitaker, we're going to pivot slightly now to a common treatment question. What are the potential side effects of common breast cancer treatments, and what options exist to help manage them?
Sure. So I think first, my thought goes to surgical side effects, because most often patients do have surgery first, and since I'm a surgeon, that's kind of where my mind goes. And similar to what Dr. Illich was saying before, we think really carefully about where to place scars so that it isn't super noticeable for the woman going through this. So a side effect could be cosmesis concerns, scar concerns, but again, we try to reduce that by being very mindful of where our scars go. Another surgical side effect could be lymphedema if we have to do any lymph node surgery at the time of the cancer surgery, and that is permanent arm swelling. That can be managed. We have lymphedema specialists. Women can wear sleeves depending on how severe the lymphedema is, but there are treatments for it. And then after surgery, many breast cancer patients have to undergo radiation therapy, and the most common side effect from that is fatigue. But a lot of our patients who are still working, they'll go to their radiation treatments during their lunch hour. They can still work. It's not fatigue where you're like bedbound and can't do anything. And then also there can be some skin changes, but usually those skin changes go away over time after the radiation treatment ends. And then there's lots of different chemotherapies that are used for breast cancer if a woman does need chemotherapy, and those side effects have a wide range of kinds of side effects, hair loss, nausea, but our medical oncologists are really, really wonderful at prescribing medications that can help with the nausea. There's something called cold capping that can help with hair loss. And then finally, some women are candidates for anti-endocrine therapy, and some of the side effects for that are hot flashes or joint pains. And again, our medical oncology colleagues are really great at prescribing various vitamins or switching the anti-endocrine therapy to help with those.
Thank you so much. Yes, I know Mary Washington Healthcare is very lucky to be, we're one of the few facilities in the area that has cold capping, which can help save hairs during treatment. So thank you so much for that. Ashley, many patients are surprised to know that Mary Washington Healthcare offers the services of oncology nurse navigators. How does an oncology nurse navigator support a patient with cancer?
Wow, I think the term navigator can be a bit abstract for most people. So, in the simplest terms, what I tell patients is think of me like a helpline through the Cancer Center. Anytime during the process, you can reach out to me. Sometimes it's a simple question, or maybe you've run into some type of barrier that prevents you from moving forward, like insurance, transportation issues, things like that. Navigators are here to guide you through the process from the initial care coordination. Like I meet a lot of ladies through the Imaging Center for Women at Diagnosis, but then into survivorship. We're here throughout the entire process. We also assist providers in the health system if they discover a barrier to care and they need our help as well. Navigation services are available to any member of our community. We serve Fredericksburg and all the surrounding counties. There are actually 8 of us. So there are 8 oncology nurse navigators. We each specialize in a different area. So myself, and then I have a coworker, Megan, who also is a breast navigator as well. And Addie, do you want me to go into our support services?
Sure, that'd be fantastic.
Okay, so we actually have a pretty robust list of support services through the Cancer Center. I would recommend tapping into any support service that interests you. These services are designed to improve your quality of life and make a difficult time a little less stressful. So we have an integrative medicine program, which includes chair massage at treatment. So at our medical oncology practice and our 2 locations for radiation oncology. We have a Reiki provider and yoga. We have a breast specific support group, and also it's kind of like an open to all support group. So if the patient and family, friends, etc., wanted to join, that's called Coping Together. We have a bra fitting service. So we have a lovely lady named Bonnie Bell. She can see patients before or after surgery for bra fitting. We have a wig room. We have a registered dietitian for nutrition counseling. We have a social worker on our staff. So she really helps the oncology navigators with financial and transportation issues. And we have a licensed therapist on staff for mental health counseling. So we're really blessed to have such a big group of support services. And that's just through Mary Washington. We really tap into a lot of resources in the community as well.
Yes, thank you. I know I'm really impressed every day. It seems like there's a new support service being offered. I'm very impressed with you all.
Yeah.
All right, so we're starting to get to the second part of our agenda tonight, and we're getting some questions from the audience. And I'm going to go ahead and give this one over to Dr. Blanchard. Is it a lumpectomy as safe as mastectomy?
A lumpectomy is actually removal of the tumor itself, as well as a small normal bit of breast tissue around it. Now, often when we do a lumpectomy, we do follow that with radiation. And I always tell patients a lumpectomy with radiation is the same result as a mastectomy, which is taking the whole breast off. Now, in some situations, a mastectomy is warranted, but and sometimes the patient wishes to have a mastectomy, but there's no difference in terms of local treatment, whether you do a lumpectomy or mastectomy with radiation plus mastectomy. So yes, both safe.
Okay.
Now the lumpectomy is typically an outpatient procedure. Mastectomy is typically not. And anytime we talk mastectomy, we do approach the option of immediate reconstruction.
Thank you so much, Dr. Blanchard. Dr. Illich, is it bad when you have to have chemo and radiation, or is it just a precaution?
So that's a kind of loaded question. It's not necessarily bad. I mean, how can we come at this? I would say, kind of going back to what we were talking about earlier, it depends on the individual situation and our goals for treatment, which of course most often is curative. The chemotherapy is, if I'm understanding the question, can be more what patients are more fearful of because of the side effects that can go along with that. And oftentimes, when chemotherapy is indicated to a certain degree, it does. It is indicative of a more aggressive cancer that's being treated. Radiation, not always, but radiation also is not nearly as what Dr. Whitaker talked about. The side effects from that are often a lot more tolerable. And so radiation may be more indicated when we're having more localized earlier stages, and the chemotherapy is not necessarily there, or in pill form, but more advanced chemotherapy may be indicative of more advanced cancer stage. As far as them being bad as side effects, it's a double-edged sword, right? We want to get rid of the cancer. It's bad. We have to always remember the cancer is bad. And chemotherapy and radiation, while they provide good results oftentimes, most of the time, obviously, because we are always driven by do no harm and the benefit outweighs risk. But they do unfortunately come with side effects. And so that's part of the discussion and the recommendations when we come up with those from the team approach, take those into consideration, and ultimately having that discussion with the patient determines whether or not the chemotherapy or radiation is just too bad. And I can't go into all the specifics because every patient and situation is really different.
Thank
Expand
you so
a little
much.
bit. I'm sorry. I want to expand a little bit on what Dr. Illich was saying. There's a lot of confusion on patients about radiation and chemotherapy. They are two totally different things, and they treat two totally different facets of cancer treatment. Radiation is localized. Chemotherapy is designed to kill tumor cells that could be in the rest of the body. And I have patients come in, well, if I do radiation, do I really need to do chemo? And you sort of have to explain that they are two totally different things. And so, yes, she's entirely correct that these are bad things, but the cancer, and she's exactly right, the cancer's worse.
Thank you. So this might be a follow-up question to this from our audience member, but can you avoid radiation if you choose to go the route of a mastectomy?
If that's for me, yes, often you can. Now, there are a few situations where radiation can be recommended after mastectomy, and that's for very large tumors, a lot of nodes being positive. But for the most part, radiation can be avoided with mastectomy. But again, it's a way different operation too.
Thank you so much.
And I'll segue off of that too, Addie, if I can, just to back off of that too, is that a lot of times we get the question, or at least I do, a lot of times patients are trying to also avoid chemotherapy. And what surgery can be done to avoid the chemotherapy and all the side effects that Dr. Whitaker spoke to. And the same thing, it really just depends on the situation, but oftentimes that decision is independent of which surgery we are doing. So sometimes the misperception is that the larger the surgery and the mastectomy that can be done, that will eliminate the need for chemotherapy. And unfortunately, that is not always the case, unlike in radiation, except for those select circumstances that Dr. Blanchard spoke to. But unfortunately, we wish as surgeons that we could just take care of everything. That's usually our surgeon mentality, but we do have a whole team approach because that discussion and the indications for either radiation or chemotherapy also go hand in hand.
Thank you so much. Dr. Whitaker, we have another question from the audience. Can you talk a little bit about immunotherapy post-treatment and surgery?
So immunotherapy, not everyone needs it. We have, so one of the agents that we use, or that our medical oncology colleagues use, is Herceptin, which targets a very specific part of type of breast cancer, HER2 positive breast cancer. But only a minority of patients have that kind of breast cancer and need that kind of therapy. Very, very small subset. So most breast cancer patients won't need that. And it would be after surgical approach.
Thank you. Thank you so much, Dr. Whitaker. Ashley, I have a question for you here. If a patient was interested in scheduling an appointment with one of our physicians here tonight, how would that process begin?
So our breast surgeons are located at Mary Washington General Surgery in the Lee's Hill area. They will see ladies for any type of breast issue, from breast pain to breast cancer. So you can schedule an appointment with one of them. You can call the office directly, or you can certainly call me if you have questions, need guidance. Also, if you are due for a screening mammogram, you can call Medical Imaging of Fredericksburg. They have 6 locations, and I know they'd be happy to get you scheduled. So we can leave the number to the surgeon's office, and then my number and Medical Imaging in the chat.
Wonderful. Thank you. And Dr. Blanchard, earlier in today's session, you talked a lot about treating every person individually. And I think the next question kind of leads into this. What role does lifestyle play in breast cancer prevention? And are there any steps people can take to reduce their risks?
Yeah, I'm going to go with the American Cancer Society recommendations, and body weight is very important. Exercise is very important in preventing breast cancer. Limit alcohol, 1 glass of wine a day, and avoid or limit hormone replacements as you're going through menopause. I mean, there's some situations where the perimenopause can be horrific, and bridging between premenopause and postmenopause with a certain amount, kind of a low level and short-term hormone replacements is okay. For patients who are at extremely high risk of breast cancer, haven't been diagnosed with breast cancer, there can be medical alternatives such as raloxifene or Evista in helping. It's a chemical, a pill that you would take that can cut your risk of breast cancer as well for women who are really at high risk. That's probably the best recommendations that I have, and screening.
Wonderful. Thank you so much. Well, it looks like we're coming to the end of our time here. I'd really like to thank our panelists for sharing your time and expertise. And thanks to you, our viewers, for tuning in to Ask the Experts. If you have any questions about Mary Washington Healthcare's cancer services, we invite you to visit our website for additional resources. You can find us online at cancer.mwhc.com. And be sure to watch the Mary Washington Healthcare Facebook page and other social media channels to stay informed of the latest health and wellness information for our community. Again, just a final reminder that October is National Breast Cancer Awareness Month. This month, we honor all of those who are surviving today. At Mary Washington Healthcare, we consider all patients survivors from the moment of diagnosis and beyond. So please check our Facebook page for more information on next month's Ask the Expert. We'll be covering gastrointestinal cancer. Until then, stay safe and healthy and have a good night. Thank you.
Thank you so much.